Hello and welcome back, guys. Now, many folks want to make a change when it comes to their appearance, but before you head to the doctor, it's best to know exactly what you want. Dr. Raymond Wolf joins us today to help us find out the truth behind facelifts. Doctor, welcome.
Thank you.
Now, I don't know if this is just in time for Valentine's Day, because how do you start that conversation with your significant other?
Nicely.
Nicely.
Gently.
Now, tell us about facelifts. Obviously, everyone assumes it's a very invasive surgery, but things have changed, correct?
Things have changed. With new anesthesia techniques, there's actually patients that can have a facelift with no oral or intramuscular drugs at all. Those are more uncommon, but it can be done.
Okay, because usually when I think about a facelift, I think about the super extreme look, or you described it as the permanently windblown look. So what are the ways that they're using to tackle that? How has it changed?
The old lifts used to pull skin backwards.
Okay.
So that's where the windblown component came from.
The cuts on the forehead, right? The incisions made.
Correct. And for a true facelift, you still need to make an incision.
You still need that.
But it's hidden well.
Okay.
It's hidden in the hairline with a change of the angle of the incision, so actually the hair grows through the scar. Then going behind the ear, this is called the tragus, so that there's no telltale straight line. It probably takes me a half hour just to suture the closure, because you want to make things look natural and beautiful.
And these looks look very natural. They don't look like they had much work done at all, if anything. Correct.
And that's the whole goal, is you want a natural look, and it's bringing you back to the way you were before. That's why we call it the rejuvenation center, not the alteration center.
Not a whole new person.
Correct. We're bringing them back to what they looked before. So if you had a significant other, it is not like you're asking them to alter themselves.
Correct.
They're just bringing themselves back to the situations that they were in before.
And you mentioned there are some alternatives to actually getting a facelift. There are some other rejuvenation procedures.
Yes.
What are some of those?
I've created a procedure called Laser Lipo Plus, and it essentially uses laser, classic tumescent liposuction, but then we use a rolling device to tighten the skin. So if someone comes in and says, I'm just not ready for, or I don't want to undergo a surgical procedure, then the Laser Lipo Plus can treat the jowels. We have special cannulas, which are the things that we remove fat through, to treat the jowl area. Then we go along the jawline, and then all the way down to the clavicle. And so it can do a great rejuvenation, very popular with men that don't want to have the stigmata of having had a surgery done.
Cosmetic surgery.
Correct, correct. And it can be combined with eyelid surgeries, which are called blepharoplasties. We use laser for that, so many times there's hardly any bruising, so they're early return to work, natural approaches, and then combined with techniques such as medical chemical peels, microdermabrasion, and a wide range of other techniques.
Yes, and we have your information up there.
Oh,
If anyone
thank
is
you.
interested in getting these procedures, and obviously you've received many accolades as a cosmetic surgeon, but I would assume key to research and know who's working on you, correct?
Correct. And knowing that the techniques have been utilized, we've been doing this since 1998, so we've been around for a long time, and you learn as you go, and you learn who to do and who not to do. There's some individuals that are not clients, and that is probably more important than knowing who is a client that is appropriate, is knowing who someone is that shouldn't have things done. Correct.
Very good. Great information. Thank you so much, Dr. Wolf.
You're quite welcome.
Well, if you're still clueless as to where to take your love bug for Valentine's Day, well, a great show always works, and Sean is standing